Welcome to Casual Talk with Pediatrician Mom. We'll be addressing some of the common questions that parents have, and I'll be sure to throw in some of my experiences from a pediatrician perspective and most importantly from a mom perspective. Today we'll be discussing fever. Fever is one of the most common chief complaints that we do get in the clinic. Fever, by definition, is an abnormal elevation of the body temperature. By definition, in the clinical setting, fever is any temperature greater than 100.4 degrees Fahrenheit or 38 degrees Celsius. Let's talk about ways to measure the temperature. You can measure it in the forehead, you can measure it in the ear, you can measure it orally or in the mouth, axillary or in the armpit, and rectally from the bottom. That being said, the most accurate way to measure the temperature is rectally from the bottom. I know not everybody feels comfortable getting a temperature from the bottom, but it is the most accurate way. Keep in mind that checking the temperature orally is your second most accurate way of measuring. I typically recommend for kids 5 years and older to check it orally, as they have the ability to sit still and follow instructions. Kids younger than 5, you can go ahead and check it on the armpit, with the caveat that if the temperature is greater than 99, you have to recheck it rectally. One of the common questions I get asked is, what's the most accurate thermometer to use? That is a tough question because it depends on what is your goal, what you're trying to achieve. If your concerns is the accuracy, I would definitely say go ahead with one of the digital ones that would facilitate you to check either orally or rectally. Or if you're trying to go with something quick and easy, it's completely okay to use one of the thermometers on the forehead or in the ear, but I typically recommend all of my patients to keep a thermometer that would allow them to check orally or rectally in case they need to. Now let's switch gears and talk about causes of fevers. Infection is one of the common causes of fevers. Infection can be caused by either virus or bacteria. Examples include ear infection, common cold, UTI, stomach bug. Typically with those, you will have certain signs and symptoms to clue you in. When do you treat a fever? This is the part I say fever is your friend. I know most parents don't want to hear that. When your child is sick, uncomfortable, and is suffering, it's very hard to sit there and do nothing. My rule of thumb is, regardless of how high the temperature is, if the child is uncomfortable or behaving differently, go ahead and treat the fever. However, if they have a temperature of, let's say, 102, but they still look well, they're active, they're playing, I would just say continue to monitor and then not necessarily need any treatment at that time. So talking about treatment, one of the most important things to do is to keep your child hydrated. When you have a fever, your body's fighting an infection and you are burning a lot of energy. So you need to replace the fluid that you're losing in that process. So hydration, hydration, hydration. The next thing, talking about fever reducing medication. We have Tylenol, which is the same thing as acetaminophen, and ibuprofen, which is the same thing as Motrin. We typically recommend going first with Tylenol. Tylenol should be used every 4 to 6 hours, and the dose is weight-based. So it's very important for you to figure out what dose your child needs. We do not recommend alternating between Tylenol and Motrin. However, after Tylenol has been administered, you should wait about 30 to 45 minutes for Tylenol to take effect. After, if the fever is still high and the child is uncomfortable, you can go ahead and switch to Motrin. Motrin is also weight-based and is typically recommended for kids older than 6 months. Motrin is to be administered every 6 hours. We don't recommend alternating between both because it increases chances of medication error. I hope these tips were helpful. Please keep in mind these were just general medical information. If you have any questions or concerns, reach out to your pediatrician. Thanks for watching, and I'll see you in the next video of Casual Talk with Pediatrician Mom.